from our experience, the main segments that we've been looking at have been smallholder farmers, mostly because that's the largest, I would say, employer in the agriculture is the largest employer in Africa. And so you find that many of the population will have some affiliation to agriculture, and smallholder farmers are the bulk. We are also targeting informal workers, who are the people who either do casual jobs. So think of the border riders, think of the casuals, maybe in construction sites. We also look at informal groups, and in Africa, we see a lot of, I would say, small savings groups. In Kenya, we call them chamas, where people come together, they contribute monthly. And so there's a financial relationship within the group, and there's also savings. And in case of any bereavement, there's also contributions. And so this is a very good space to tap as they face business risks, they face health risks. And so this is an opportune place for insurance to look at. In terms of how to effectively target them, I think one of our success stories have been simplifying the products and making it more accessible, either digitally or through partnerships. And so you're able to tap into these segments with lower acquisition costs, but at the same time, effectively, such that the segment or the target market is able to purchase insurance seamlessly. We have two models that we actually run in Britam. So we run both a B2B model when it comes to distribution, but also a B2B2C model. And I would compare the two depending on the product and who you're targeting as the end buyer. So for the B2B partnerships, we tend to work directly with maybe employers. So think of maybe your supermarkets, think of the retail chains, being able to effectively provide health insurance to their employees who would still fall under this low income community. Then the employer chooses to buy maybe a health insurance product or a funeral insurance product on behalf of their employees. But the most effective that we've seen, distribution model that we've seen, is the B2B2C partnerships, mostly because we find that you create a partnership with a business or an organization, and then the consumers are the ones who will be the individual policyholders. So you create, so the consumers are able to know that they actually are covered. They're able to enjoy their cover. They're able to understand what exactly the insurance product covers. Such successful partnership has been with Kenya Tea Development Authority, where we've been running a health insurance program for the tea farmers, and currently we have 200,000 members. These are voluntary products, and so it's Britam in partnership with KTDA, and we are able to tap into the farmers because we leverage on the KTDA agents to be able to sell the product directly to the farmers. The beauty of this partnership is that we're seeing a lot more loyalty, we're seeing a lot more retention, and also value when it comes to the product to the farmers directly, as opposed to B2B partnerships. Another very effective partnership that we've created is with Safaricom, where we've directly collaborated with Safaricom for a personal accident cover that is embedded with data internet bundles. So here the customer actually chooses to buy a bundle with insurance, but then the partnership is from a very high level with Safaricom. And so with these models, we see more stickiness and more value to the customer as opposed to just direct B2B partnerships. As Britam, we've been able to cover actually 4 million lives, particularly when it comes to microinsurance. And they're within specific programs. So there's a health programs, there's the funeral programs, there's crop insurance as well as flood insurance. But particularly, maybe I'll talk about flood insurance, which we did recently. And here, we were targeting a group that is based in Tana River County. So Tana River County has been well known to have very adverse floods. So although they're not as frequent, when they actually happen, what happens is that the households completely lose out all their belongings, all their property is lost, any crops that they have are completely destroyed by the floods. And so we chose to do a pilot in partnership with Oxfam to be able to provide coverage to 300 families, about 1,000 lives within this program. And during the El Nino floods, we saw that there was tremendous adverse effects when it came to this community. And the insurance program that we created, which was a parametric insurance program, was able to provide quick payouts to the households. And so the households were able to almost start off and go and build new homes, be able to provide some form of school fees for their kids. So what we've seen is direct impact of what insurance can do to these communities, particularly knowing that for them specific community, most of them were having insurance for the first time. And most of them had never really heard about insurance. So this was a direct testament of how insurance can improve financial security in terms of floods. From our end, we strongly feel that public-private partnership in microinsurance is very critical, mostly because you're trying to target a mass market and it can be very expensive to reach everyone. It may be very hard to build trust. And so this is where the role of government comes in. With joint collaboration with government, you're able to leverage on our underwriting expertise as insurers, but more so you're able to tap into the credibility that governments have when it comes to any form of services that they are providing. They also have access to huge amounts of data. So depending on the program you're running, whether it's health, whether it's agriculture, whether it's disaster response, government tends to have a lot of data on the area, on the people, and so this is very important to the insurance companies when it comes to the development of the product, but also just being able to know who the right segment is. And then finally, financing. So government can come in to provide some form of premium financing, although they may not want to do 100% subsidy. What we've seen is at levels where they can start with providing a high subsidy and they try and cascade it through the years, mostly to create almost like an insurance culture within the group that they're targeting. So we've seen two very successful models that have worked in Kenya particularly. And the first one is the Kenya Agricultural Insurance Program, which is a agricultural PPP between insurers, between the government and also now the farmers. And this is targeting the maize value chain. And the government comes in to provide some form of subsidy. They provide expertise through the agricultural extension officers, and the insurers are coming in to take up the risks. So with this, I think thousands of farmers have been able to be reached, and it's a continuous program. This is mostly as a success of collaboration with the Ministry of Livestock, where they're able to provide the livestock officers to even mobilize the communities, to engage with the communities. And just having the government being in the program, we saw that there's more credibility given to the community, and so they are more willing to purchase. There's also premium financing that the government was providing, which enabled at least to have members come on board, and now we're seeing even more pastoralists are willing to pay out of pocket because they've been able to enjoy some benefits from being part of the insurance program. So in terms of PPPs, I think the value comes in achieving scale, credibility, but more so just being able to leverage on the expertise that each party has. One of the main challenges that we have in our markets has been that just wrong perception of insurance. And I think it's a historical thing that we're dealing with. So how insurance got into the market, they were not paying claims on time, made very complicated programs. So this has really stayed with us for a long time. And I think one of the ways that insurers can try and curb this is particularly developing simplified products. So if you were to look at an ordinary insurance policy, it has very complicated features with a lot of jargon and lengthy exclusions. I think exclusions tend to be between 20 to like 40 exclusions in a policy document. And this just makes insurance like harder to sell and harder to understand to the end consumer. So one of the ways in which insurers can try to improve on this is creating very simplified products. What we've seen is creating like a one-pager policy document really helps. And that means you have to limit your exclusions to less than 5, like actually, or close to nil. Also just developing the features to be very straightforward. If you're selling a health insurance program, not having multiple sublimits and trying to create very complicated terms within the product. The second one is digitization. So just having the customer be able to purchase the insurance by themselves or have someone be able to purchase the insurance on their behalf, but very easily from their phone, either through USSD or through WhatsApp, has enabled at least someone to understand more and enables the accessibility of the insurance product. But I think the most important one is paying claims. What we've seen is that when we pay claims, then there's more trust built within the ecosystem. So if you're working with farmers and other farmers are seeing that you're actually paying for claims for other farmers, then it's the quickest way to sell an insurance product. So paying claims on time and just creating a seamless claims journey. So that means that if someone has purchased a health insurance product, you're not asking them to go pay at the hospital and then make them come and claim from Britam. You're actually maybe working directly with the hospital so that someone is able to enjoy services seamlessly. And then I think finally is just like improving the awareness on insurance. So what we've seen work well, particularly in the agri sector, is when you're working with extension officers, maybe government extension officers, who are able to build like almost education around insurance, how insurance works. Because most of the time, I think there's insurance illiteracy, where someone doesn't understand exactly the mechanics of insurance, and they believe that each time that they pay they should be able to get a claim paid by the insurer. But then I think just being able to build awareness on how insurance works, that is very critical. So I think here there are multiple ways to look at it. It depends on actually the business's objectives. So where we've seen some businesses are more focused on scale, so reaching as many people as they can, and not necessarily making as much revenue from the business. So I think from a potential viability is one is that microinsurance takes a while to actually get to profitability. From Britam's experience, we started in 2007 and were only able to achieve profitability in 2016. So that was roughly 9 years later. And so one is being able to be patient, and as long as you're seeing scale in your product, then that's already an indicator that there's value and that there's demand of the product. One other metric that would be critical is the loss ratio. So this is the percentage of claims against how much revenue you're collecting. From our experience, if you're seeing a very low loss ratio, it's already an indicator that your product is not providing value to the end consumer. And so we tend to see that if you need to have a balance of profitability against value to the consumer. And so you have to have a sweet spot when it comes to the claims ratio. So make sure that people are actually able to claim from your product. The other thing is looking at the customer reach. I think for us as Britam Microinsurance, our main target is to reach as many people as possible. And so once we've been able to reach these people, we can try and upsell to higher value products. So one of the ways we do it is providing very bite-sized, simple products as an entry point, and then being able to upsell them to maybe higher value products like health insurance for the business and revenue that is needed to deliver the profit. And some maybe other metrics that we try and follow is like the revenue per customer, the profit per customer. And of course, because we are a commercial business, we have to look at the profit before tax while we are also doing this business. So I would say those are the key areas that we're looking at. But I think just to demystify some of the myths that exist is that, yeah, there is profit to be made in microinsurance, and microinsurance can reach the scale that other general insurance companies actually have. So it's about having patient management, patient boards, and patient capital to enable you to reach that profitability.